Hello, Paul. I'm gonna not say how are you today, just to give the listeners a quick update. We have a normal In the Headlines episode coming in about 10 minutes, I would guess. But first, we have somewhat breaking news that we just really need to talk about that came out yesterday. So the big news is that Richard Pazdur, director of the FDA's Oncology Center of Excellence, has taken the job as FDA's director of the Center for Drug Evaluation and Research, so CDER. And that there's a lot to talk about here. He is taking over for Dr. Tidmarsh, and let's get into it, Paul. Why don't you? Because I didn't
report over for Dr. Tidmarsh. He's taking over from Dr. Tidmarsh. Yes.
True.
So we have had a news outbreak.
Mm-hmm. Yes.
So now we're pivoting, and it's going to be great. So let's talk about Dr. Pazdur.
Yeah, can you tell me what this means for the CDER side of FDA?
Well, I think for the entire FDA first, right? Because FDA has been in a state of how you say chaos. That's the right word. People leaving, and they don't really want them to leave because right now they have 1,000 positions that they can fill. It's just that does anybody really want to go to an agency that looks rudderless? Let's call it by its proper name. And the thing with Dr. Tidmarsh is that he really didn't you got to listen to what's coming with the other episode about his ouster, his downfall, whatever you want to call it. Yes. He was an outsider who was kind of wearing his outsiderness on his sleeve. Pazdur is the exact opposite. He is an insider with a vision, with a sense of what he wants from the agency. And if you're asking me as an observer of FDA for more than 3 decades, the thing with Pazdur is he's had the same vision for quite some time, which is reorganize the agency based on disease groups. Because to quote Dr. Pazdur, nobody gets ill with small molecule or biologic. People get diseases, not modalities. So, and besides, I could never really understand what in the world, what is the difference between biologic and a drug, a small molecule? Who cares? And that is, I mean, people can answer that question. I just think it's an idiotic answer. The people get sick with, diseases, heart disease, cancer, what have you, but they don't really get small molecule. Again, I'm stealing from Pazdur, but he is, he's the kind of guy who's been playing 3D chess in his head for a long time. And he can actually, he sees how things can come together.
Yeah,
he's got the mind for that. And there are lots of people who believe in what he's saying. And frankly, I think he's making a really fascinating choice. Now, seeing him at CDER, and I think he's going to stay at the Oncology Center of Excellence as well. So he's going to be there as well as. But yeah, can we just go to his vision for another moment?
Please.
So the drugs part of ODAC and drugs part of CDER, the part that he's taking over, really just does the largest number, but really a portion still, not all of cancer drugs and cancer modalities. So some of them treatment modalities, some of them are going to be in CDER. So the question is, he's not head of CDER. The question is FDA going to be ready to do what Pazdur wants to do? And that means taking, some of the CDER stuff and moving it over into a physical center. And that's been a fight.
Really?
So, Yeah, people, people don't move these fiefdoms. They don't change. But the idea that they got him means a lot.
Yeah.
Means a lot, because you don't just, I suppose he can just walk out if he's had enough at some point.
Yeah,
But
true.
I suspect he really is going to succeed at this. My money, I'm willing to bet you as much as $5 that this is really good, and it's going to cause complete changeover in how drugs are, drugs and biologics and so forth are dealt with. And by the way, there's also some of it is also devices, because devices are really important in oncology.
Yeah.
So people don't get small molecule, and get sick with small molecule or biologic, but they also don't get sick with devices.
Yeah. Well,
So,
sick from devices. No.
Yeah.
Yeah, I mean, I think
good. Yeah, I corrected you. You corrected me. Even somebody should keep the score.
Yeah, I mean, I don't want to. Yeah, I know. Seriously, right? We can have a little tally.
Yeah.
No, I think I don't want to drag this out too long. I think there's a little delay. I'm sorry,
I have
Paul.
got time.
No, but I think I just, I haven't been covering Tidmarsh. It's really been you and Claire. And, this is breaking news. We haven't done like deep reporting on it yet, but, we know Pazdur pretty well, as well as reporters can, and I think, from my very outsider standpoint, I'm really excited. There's really no one in oncology that I respect more than Pazdur. And I think that, considering, like you said, FDA is so rudderless, even though it's a little jarring to think of Pazdur, not just being oncology center of excellence, God, like
the word he hates is cancer czar. And
yeah, I know. I almost said it.
And
I almost said it.
So
yeah.
I'm sorry, Dr. Pazdur, if you're listening. I'm the one who coined it, and I'm really, really sorry.
Yes, I didn't say it. But yeah, I mean, he's just such a figure in FDA and oncology more broadly. And while I do have a little bit of nerves at the idea of him splitting his time, just because I enjoy him working at meetings and stuff, like you said, if anybody is gonna take on more responsibility and have a vision for FDA and bring in positive change in this time of chaos, or let's just say change, let's just say tumultuous change, perhaps. It's him.
It's gonna get less stable. That's my prediction. Before it gets more stable, because his counterpart Vinay Prasad, if you look at his entire sort of body of work, all of his literature, he is digging under the things that Pazdur has been building. So is this going to cause a battle of titans? If that does, then my money, again, it's another $5 bet, is on Pazdur. Because
oh my gosh, I'm about to. Yeah, well, I don't want to make these bets though.
But you haven't bet against it, so whatever. It's a symbolic bet. Yeah, we'll just donate money to what?
To each other.
To the beer fund.
There you go. That works. I'm in.
Yeah, so this is as important as the fact that the administration's plans to change over NIH and really gut it has been stopped. This is as important as the fact that Tony Latai is now the NCI director. Yeah. This is big because the whole field of oncology over the past 25 years that he's run the oncology division and changed the drugs and decided which drugs would get on the market, which drugs won't get on the market. Yeah. Everybody is speaking Pazdurese. Even if you don't like Pazdur, you are speaking Pazdurese if you're doing oncology, and he's shaped it. Yeah. So I don't think anybody has had more impact on this field than he has. So now here he is, and I suspect there's some people who are unhappy, but I think there's what I'm sensing is a lot of dancing in the streets.
Awesome. Awesome. Well, listen on for the podcast that Claire and Paul recorded. It will come in right now, and you'll get more information about Tidmarsh and his ouster, which is very relevant to to Pazdur's being named. So,
Yeah. So
yeah.
we've got basically it's all upside down and
Topsy-turvy. Yeah.
topsy-turvy, but upside meaning that part 2 comes before part 1. So I guess one thing you could do is just play this podcast backwards.
Get some devil speaking in the background there.
And now we return to our previously scheduled program. So Claire, how are you? Did you have a great weekend?
Hi, I did. I had a really good weekend. I went to a documentary premiere for my friends, and I've just been kind of holding up inside because it's rainy and cold. So it was cozy, though. What about you?
I went to CI4CC, which is the Cancer Centers Informatics Society meeting, which was in Miami Beach, and it was a lot of fun. I love that meeting because very few people, on the ground, I have no idea how many people queued into this thing because they're techie people. They don't need to be there in person. But yeah, it was just really nice to go and see a bunch of friends and just sort of wander out and look at some Art Deco buildings again. And they don't change. Well, they get a little better painted. And I got home. That's the part that's great. I was able to get back on Sunday. Yeah. I got lucky. So anyway, so what happened? We had a very busy week last week.
Very busy week. Yeah. I mean, you were editing at the airport with me live. But yeah, I'll do the honors and give us the rundown like Jacqueline usually does. Story 1 was the directors last week with Ruben Mesa and Kunle Adunsi on the internationalism of the oncology community. And then the next 2 stories were about CDER director George Tidmarsh's ouster and the events that preceded it. So the first was reported by Paul and myself. And the second was a guest editorial written by Dr. Sakaris. It's called How George Tidmarsh Crossed the FDA Rubicon. Super interesting. It's our top trending story at the moment. It's definitely worth a read. We had another guest editorial on next-gen sequencing by Kathy Davey from Thermo Fisher. And we had a sponsored article by City of Hope on lung cancer. As usual, it was a very packed cancer policy section, which has kind of become, our catch-all for all the news and policy changes that we would like to write about, but can't write about and can't get into an issue. So, but end up being really strong stories at the same time. But yeah, the big news that we want to talk about that happened over the last weekend, so October 31st through the 2nd, was that FDA CDER director George Tidmarsh was put on leave on Friday to be investigated for his quote unquote personal conduct. And then according to multiple interviews, Tidmarsh didn't see this coming. Sunday morning, confirmed by an HHS spokesperson, he resigned. Sunday was also the same day that Aurinia Pharmaceuticals filed a lawsuit against Tidmarsh for signaling out the company due to a personal vendetta. So, I mean, we reached out to HHS and kind of received the same response that everyone did, which was that, Secretary Kennedy expects the highest ethical standards from all individuals serving under his leadership. Earlier that week, Tidmarsh had made an appearance at BIO, which is Biotechnology Innovation Organization, interviewing with John Crowley. And at that fireside chat, he said some things that were pretty alarming. And those comments are the basis of Sakaris's guest ed. So, I mean, going into this reporting, I was like, well, Occam's razor, he resigned the same day that a lawsuit was filed, right? So clearly that's the reason he resigned or was ousted or whatever we want to call it. But it did seem, as we dug a little deeper, that there was a lot more than what met the eye. And I will say it was not easy to get a recording or transcript of that chat. I called and emailed every press person associated with Bio, and no one had a recording. Or was able to give me one, and which was, this was essentially FDA's top drug regulator dishing. So, Paul, over the weekend, then I guess you used your reporting wiles and got us a recording, which turned into a larger story for us. So, what was most surprising to you about this recording of this chat?
It was kind of fun because I went out into the street and there was this huge wind gust, and the wind gust brought me the recording of the bio gathering.
I love when that
know
happens.
it's really great. Well, let's go back to your stuff,
Yeah.
your part of the story. I mean, we kind of shared the entire story, but you were doing all of that kind of the alleged personal vendetta part of it, and these are two separate issues. Actually, it could even be three separate. It could be more than three separate issues, because we don't know whether he resigned because of we know he resigned because of the investigation, but what were they investigating? Is it the same thing that was in the lawsuit? We don't know. Probably, but probably isn't good enough. And as far as the fireside chat, that's completely separate. That we know. So the fireside chat, we abstracted it in the story, but we also published the entire thing because just to make sure that everybody sees it, that it's not being quoted out of context. The context is all there. Well, what was, the thing, one of the takeaways for me is that whenever they put you in an armchair and say, Dr. Horseface or whoever, Mr. Goldberg, you are in a fireside chat, and then, you get very comfortable. You get lulled into complacency by the sound of your own voice. And then you say a lot of really crazy stuff. And I may have done this. If I have, I would not know that. So my modest proposal is that FDA start to regulate those comfortable chairs as dangerous, high-risk devices. You could end up sitting down in this chair, getting up, and you don't have a job anymore. To me, the fireside chat was the most interesting bit. So, do you want to drone on, or please interrupt me? But can we talk a little bit about the other bit? What happened?
Yeah, sure. Yeah, we should. I mean, I will say, and we wrote about this a bit when we first reported on Tidmarsh becoming CDER director, that his relationship with McCary and Bhattacharya and Prasad, these relationships kind of arose from this COVID era solidarity. So I think what is most surprising to me about all of this, and I think we use the word breeziness a lot, was just like the breeziness, kind of just maybe unseriousness, or like the lack of weightiness in some of these contexts. Like if you've listened to FDA's direct podcast, and I don't know if FDA has had podcasts before, but just the fact that there is one is a little bit odd to me, and maybe you can speak to that. But and I know all of these guys were kind of pals prior, and Tidmarsh has talked about that extensively, crashing on people's couches. And I think what's interesting, this word transparency has been thrown around a lot. Obviously, the spokesperson used that language again. And I think this podcast and this fireside chat style is all under the guise of transparency, but it kind of ends up having the opposite effect, at least on me, where my takeaway is, if this is how these top agency heads are speaking in their official capacity, like what is it like behind the scenes? It feels almost like more like oversharing, I would say, than transparency. So that was kind of something that surprised me about all of this. And it's a lot to sift through, but, going back to the lawsuit, I mean, it's public. We linked to it in our story. You can get into its pages and pages of emails that Tidmarsh had sent to, Kevin Tang, who is the current chair of the board of Aurinia Pharmaceuticals, essentially, according to the complaint, kind of like threatening revenge on him, for various ousters from other companies that, Tidmarsh had worked for, other drug makers. A lot of kind of, threatening language in those emails. And I guess this all was kicked off by an early September LinkedIn post that Tidmarsh had made about the Aurinia's a drug for lupus, just kind of singling it out and criticizing it. and eventually, ultimately took that post down, and declared that he did not post it in his official capacity, but on a personal note. Their stock drops, Aurinia Pharmaceuticals stock drops, and that was the basis of the lawsuit. I think those are the kind of the most interesting parts. I think, making personal comments about the safety of a drug on your social media account rather than through official FDA pathways shows maybe a lack of judgment, to be nice. But it's also kind of not, surprising. Like, a lot of these guys will kind of go directly to the masses and not through traditional pathways. But I mean, what are your thoughts on that? Is there anything else really to talk about?
Yeah. I mean, FDA used to speak always in kind of two different ways. One of the ways is well-honed, lawyered, policy way. And that is what counts. And I miss those days when there was more of that. So you have somebody write some text, somebody fix the thing, and then keep on going, and then they think of the implications, and God knows. It was not a human language. But you know what? It was language you could act on. At the same time, FDA would show up and talk at various gatherings like Friends of Cancer Research, and FDA officials, including, CDER directors and CBER directors and what have you. Certainly the Oncology Center for, the cancer division, Rick Pazdur always there. A lot of medical reviewers are there. And they can talk, right? Or at ASCO they do the same. There has been, but that's not the same as policy language. It's kind of like developing things, thinking things out, hashing things out. And my God, many words I said at ODAC. Oncologic Drugs Advisory Committee meetings are filled with, just not blather at all. It's actually erudite discussion of data, policy, what have you. And you can see opinions being shaped, opinions being made, and being forged, and, expressed, and recommendations being made. Right. So that's very different from this kind of blather and transparency are not the same thing. These guys are getting a little bit confused as far as I'm concerned. I don't understand half of what they're saying, and that's usually a bad sign because I've been covering FDA for a very long time. And generally, if I don't understand something when I was younger, I used to think it was me. Now I think it's just blather. Which is why, look at the Mikhail Sakaris editorial. I wanted to bounce it over to him, and he was kind enough to do it, and just to say, well, this is how I understand the blather that at that fireside chat or dumpster fire, as we called it. Mm-hmm. And Mikhail is a writer. He can use many words and use them well, but he uses them well. So I still do not understand what Tidmarsh said. I do kind of understand that he did say that that FDA is looking for a way to go beyond, make the accelerated approval standards different, go after overall survival. And this is interesting because that's what Vinay Prasad, his counterpart, who's also the chief medical officer of FDA, is saying. And I never really thought it was a Tidmarsh point, that it was one of his ideas, but it is the entire Prasad idea. And that Prasad now has all of these data from inside FDA, and he's been publishing on this when he was outside FDA, And now he's going to say, aha. Now, why did Tidmarsh announce it? I have no idea why he announced it. Is it because he was trying to rat out somebody whom he didn't particularly get along with? My sources say that is the case, that he did not get along with him, but still doesn't explain why he did it. It could be several explanations. We don't know them. We don't really necessarily need them. What does Tidmarsh's ouster tell us about what is happening next at FDA? Is Prasad next? Is he going to be refired and rehired again? I don't know. Is McCary strong enough to stick it out? I don't know. Rumor has it that Kennedy is not pleased right now, which is interesting to see where it all goes. But yeah, blather is not the same thing as transparency, said I, blathering, sitting in a comfortable chair.
Right.
So if I'm making an idiot of myself, please tell me. Am I making an idiot?
At least you're calling it what it is,
Yeah.
Yeah.
So that is the story.
That's the story. Yeah. And a lot of kind of contradictions that I don't know if we'll ever really have the answer to what exactly happened, but it's not good. None of it points to being good things,
Maybe we will have an answer to that. I think we'll probably have an answer to that in a matter of a few weeks, because either these guys are sticking around or allowed to stick around, or they are, told to spend more time with their families. But I can't imagine that anybody is satisfied right now with what FDA is doing. I guess I've also, once again, really kind of talked around the point, but didn't get to the point. FDA is important to the industry. The industry makes money by having a solid FDA where people are competent, where decisions are made in a way that is at least explainable. And one of the things that I heard Tidmarsh say that actually scared me the most, well, in addition to this, the idea that here is he and Vinay Prasad and God knows who else mucking around with accelerated approval. But the other bit was the voucher program. Tidmarsh was talking about calling investigators, an investigator on this rare disease situation. CDER director calling an investigator to find out what's really going on. I mean, there's process. And what message does that send to the industry? It sends the message that, hey, we are, all you have to do is just convince the CDER director. I don't know if that's a good thing. No, let me rephrase that. Let me rephrase it. I cannot say I do not know it's a good thing, whether it's a good, it actually stinks. Thank you.
Tidmarsh described himself as a student of the history of the FDA. I think that was on his Welcome to the FDA podcast. And so it just kind of begs the question, like, does he know better? I don't know.
Well, the guy we got to critique his fireside chat blather was Mikhail Sakaris, who actually wrote a book about. He was not just a student, but he wrote a book about FDA. He is a former ODAC chair. He is a writer, and I would say I would go with what Mikhail says over what Dr. Tidmarsh says. It's really strange, and it's not good. It's rotten. And the question is, where is it going?
Yeah.
And the industry, I think, wants it to go in the direction of stability, because you can make money with stability.
Right.
You know, in chaos, you can make money, but you kind of have to go through very different strategies.
Yeah, indeed.
This is a terrific time to be a journalist.
It's a great time to be a journalist. Stories unfolding. You know, I mean, I guess the one downside of stability is that we have less to report on.
Oh, no.
Not wishing for instability.
You can report on unstable. You can report on chaos.
Okay.
You just have to be stable as you report on chaos. That's the challenge, you know?
No, that's what I'm saying. I'm saying we benefit from chaos, journalists.
Oh, yeah.
We're the only ones.
We're the only ones.
Right. We should probably wrap this up.
We should, before we say something really stupid. This is becoming a fireside chat.
It's becoming a fireside chat. Yeah, my chair is becoming too comfortable.
Oh, boy.
Too cozy.
Are you lulled into complacency by the sound of your own voice?
Well, thank you for listening. Thank you for talking. And we'll see you next week.